Good day, everybody. It's a pleasure to have you join us today for GOG Partners series on how to create a culture of research and enrollment. We've created a series of video presentations, and I'm joined today by Dr. Destin Black and her nurse and head of research, Carrie Kay. So it's exciting to kick this off, and I think really what I want to focus on today, Destin, is maybe tell us a little bit of how you've gotten to where you are in terms of the research environment that you have now, and really how you've established the culture where you are. And that might be good to sort of give us the background of your journey.
Yeah, thank you. Thank you for having me, Tom. It's great to be here and sort of share my story of what I did to get clinical research into my community. First of all, I'm a Louisiana girl. I'm from Louisiana, and I left Shreveport to do a fellowship. And my goal was always to come back here. This is a very underserved community in North Louisiana. And as a fellow, I had excellent example of the importance of clinical research. That was something that I hadn't seen before, and it is definitely really an unmet need in this community when I came back to Shreveport. Initially, when I came back, my practice, give you a little bit about it, I have sort of a hybrid practice. I work with the medical school and also am with a hospital that's affiliated. It's a nonprofit hospital system called Willis-Knighton. And at the time, I just thought that to do clinical research, I needed to be at the academic center. And I really struggled to make that happen. It was very difficult, which was totally opposite of what I thought. I thought academic center, clinical research, it should be easy. But really, I worked at it for a good 12 years and was unsuccessful. And at some point,
what do you think the biggest barriers were there? Just too many layers of bureaucracy, or
so many layers. There was not the infrastructure. There were absolutely no GYN oncology clinical trials at all. I didn't have a mentor. There was no GYN oncologist working there. So I kind of got to a point a few years ago, just about 2 or 3 years ago, and I said, I'm at this point in my life. I need to really. I'm not doing what I intended to do. I'm getting closer to 50, and I had these goals that I had set for myself, and I really wasn't getting there. I felt like I was doing great as a clinician, but I knew I was not providing to my patients the best possible care, which I believe is being a part of a clinical trial. And so I actually went to administration. And I know a lot of times people negotiate contracts, and I have been in that position too of negotiating. And I guess what I would tell my younger self in the beginning is like, put that in your negotiations, like value that, let them know how important it is. So when I went to administration, I said, this is important to me. I didn't even discuss salaries. I mean, this is important to me. I want this to be a part of my practice. And they actually were like, hey, we can help you. Let me tell you about this person here. She's excellent with clinical research. This is Carrie Kay, and she has a lot of experience, which was kind of frustrating because she'd been here. She really started at the same time I did and didn't even know that each other, were doing our thing. And so they connected us. And at that time, it was really like we spent a lot of time talking about our goals and trying to develop this program, creating the culture, finding other physicians, other medical oncologists that help in the care of our patients that are interested in that, and bringing everyone together. And since that, it's 3 years now, I think we have been very successful. We have a very efficient program, and it's actually one of the things that makes it easy for us to start up trials is almost because we are small. And I feel like there are probably a lot of centers out there that are smaller, and you just got to get the right people on the bus, the right team, and don't be afraid to work with your administration to ask for help, because certainly there's some startup to that. And just be persistent and keep a positive attitude and just keep pushing forward. What would you say about what?
Yeah, I agree. I think a lot of the the rationale behind our success was that Dr. Black was not scared to go to administration, to tell them what her needs were, and to be able to kind of explain, where her interest came from and the advantages to the institution as well. I mean, there's so many advantages as far as academia, financial, as well as doing, what's great for your patients and retaining them in your, your health system. And I think being able to do that and then bring on the people within our institution that's like-minded, getting the right sub-investigators that, that have the same treatment regimen in mind as Dr. Black, and be able to support the clinical trials was key. And I think we fine-tune that with every trial we get.
Great. So, I think both of you brought up very eloquently a number of the elements that you need to conduct research, right? And the first one is a willing and able investigator. Thank you for that. And then you need patience, and it sounds like you have those in droves there.
Yes.
Yeah, that's a good thing. And then you really brought up the soil, and that's the institution. And I do think that relationship's really important. And I guess one of the things that I've found over the years, I started from scratch at Columbia when I was there. Certainly needed some work when I got to the University of Cincinnati. I'm now the deputy director. I'm Tom Herzog, by the way.
We know you are.
Anyone who cares. But the one thing about that is you need something tying that all together. And that's where I think GOG Partners comes into the organization, the fourth element of that research that can really reach kids. And we're just starting on this journey together with our investigators as a site management organization in terms of education and so forth. And so you're giving back right now by sharing your best practices of how you came in, starting really with not much of anything, and then built it into a viable research enterprise. And we'll drill down on that in a second. But I think that mentorship part of it is important. Some of that needs to come from a good site management organization, and that's really what we're trying to do here by producing these educational videos, but also really getting people information on best practices, how to troubleshoot, people that they can contact from each of the disease sites. So we've done a number of those things. But, we really want to talk mostly today, or in this first segment here, about how you establish that culture of research and enrollment. What do you think the biggest challenges were in terms of establishing the culture? Did you get a lot of resistance? Were there resource problems? Did you have trouble finding Carrie Kay? How did that all go?
Well, I think, that some of the challenges have been building our team. We've had to hire more people, really finding that Carrie always says, to be in clinical research, it really takes a service heart. And I really believe that. I mean, there's, you work really long days, and Carrie, especially during COVID, was working weekends and really trying to keep things moving forward and really be, a very detail-oriented person that needs to put in the extra time. So finding people to add to the team has probably been our biggest challenge. For me, in terms of enrollment, a lot of it has to do with skepticism about clinical research. For one, in Louisiana, we see a lot of people that are just very skeptical about how we conduct science. Actually, if anything, COVID's helped with that some, because people are seeing it now. They're understanding how important these clinical trials are and what they're creating. I had to get, the engagement of administration. At first, they were like, yes, we want to support that. But then as we grew, we needed more people. And
you built that partnership. Yes, and I'm sorry to interrupt, but how did you build that? For the benefit of some of the listeners out there. To say to go to the administration, who'd you go to? How do you identify someone who's going to actually help you be an asset?
Well, I would say if you really want to get something done in your administration, you want to go as high as up, CEO if you can, and then COO maybe after. But really just go as far up in the rank as you can possibly go. I had been here for a while at the time, I guess 12 years maybe. And so I think they valued my services. I had, a track record. But I would say in the beginning, when you're starting out, if I knew about this, that they could help me, I would have negotiated that in the very first conversation of talking about contracts and salaries and all the things you go through when you negotiate a contract. This would have been a big bullet point for me to make sure that is discussed, that this is important. If I'm going to be practicing as a gynecologic oncologist, I need to be able to offer this comprehensive care, which includes clinical research.
Absolutely, great point. So you actually get that written into the recruitment package, right?
Absolutely, I would recommend that.
If I could just interject, one thing I would also say is that with because we're still going through a growing spurt right now, and so we're continually adding to our team and redeveloping our research program. And one of the things is we finally got to the point to where it's like, okay, who can we go to that can give us answers? And I mean, we literally said the words. Who can make decisions? And, at that point, you just keep climbing that ladder until you get to that person. Dr. Black put together an excellent presentation that, really it gave the administrators a background of clinical research. It gave them some of the reasons to do clinical research, everything from, again, their financial gain to a way to retain physicians, as well as, bring new physicians into your center that have an academic mind, but they still want to be in private practice. And so they are actually incorporating that as part of their program now. When they interview new physicians, they let them know that we have an established research program. And surprisingly enough, that is something that actually piques a lot of interest. But just not being shy and being able to go. If it's something that you really want and it's something that's important to you, you have to just continue to push until you find the right person to build that program.
I think you said it well. The decision maker is the key.
Absolutely. Yes.
You said it well.
Once we've created it, we actually, to keep the momentum going, we've now set it up, since we still feel like we're in the growth phase, is we meet every Monday at 8:00. That's our time. And we have it's sometimes 15 minutes, the Zoom meeting. Sometimes it's an hour and a half, but we sit down there's 6 people involved, and we have a quick meeting. Administration is in every single one of those meetings. And we go over what's going on with, right now we're trying to hire a nurse practitioner. We created a cost center that's just unique to our little group. We've worked very closely, a lot of, in terms of just coordination. It's very good to keep meeting regularly, even if it's very quick, but just to keep that going.
Right. And how many physicians do you have enrolled?
How many
physicians do you have?
Physicians in our hospital system, I think it's 300.
We've got 500 actual practitioners. Now, currently, I probably have about 50 engaged investigators that are actively engaged, and they are actually PIs, sub-Is, and they recruit on a regular basis. For our gynoc, we have a core team of about 6 investigators.
Okay. And how does that work in terms of, did they all have that bug that you did, Dr. Black, when you arrived, that they wanted to do research? It's a little bit inbred.
Yes, it is.
You went oncologists have the bug.
Yes, actually, so some of them have the bug more than others. I will say that. I realized coming here, I'm in a very underserved area. I'm the only GYN oncologist in North Louisiana, just to put it in perspective. But I realized pretty early on that I could not do all of it. So I really tried to find a medical oncologist, just starting out, just finding one medical oncologist that felt passionate about GYN oncology. And the actual idea of me thinking of that was, I remembered when I was younger, there was a GYN oncologist in North Mississippi named Dr. Borno, and he worked very closely with a medical oncologist, Tate Thigpen. And he would come over and give lectures and just talk about, he would come give stuff at the medical school. And I sat down with him once with a cup of coffee and just asked him about kind of how that happened. And he said, well, Dr. Borno walked in my office with a plane ticket and said, you're going to the GOG meeting, the first one. And so it was like, wow, he did that. And so I kind of thought, well, that was just a clever idea. And so kind of did sort of a similar thing with one of the medical oncologists here. Of course, it wasn't, the GOG is already established, but I went in there and I was like, you and I have been sharing patients and we just have such a mutual respect. He keeps up with the literature. He pays attention to detail. That really, we need to do this. And he said, I agree. Let's do it. So he was a big part of that, getting the team going when we were first starting with a few years ago.
Yeah. So Tate, we've all had great Tate stories, but I'll just never forget as a fellow and the junior faculty watching him run the protocol committee. He was legendary for the legacy GOG group. And we're now GOG Foundation, of which we have the energy side, and GOG Partners, the industry side. So he was and is a wonderful person. So Tate's a great guy.
Yeah, he certainly made a good impression on me. And I tell you, it's like kind of like paying it forward. You teach people, you share your story, and that. He did that for me when he came and shared that with me. And I was just trying to struggle in North Louisiana, trying to make it work. And he told me, well, this is what happened to me and this is how it worked. And I was like, well, that's good. I can do it,
It shows you the span of mentorship relationships, right?
Some
can be lifelong and some of them can be literally momentary, but they're significant enough that they shape your ideals and motivate you moving forward, which is wonderful, which you've done here. I'm going to close out with asking you just one tip in terms of if you're trying to establish a culture of research and getting people to enroll on trials and making it so this front of mind, not something, oh, shoot, I forgot that we have protocols open. I didn't look at that. It's like, that's what you do automatically. What piece of advice would you give? I'm going to ask both Carrie and you, that would be. Carrie, you want to go first?
Sure. I think from my perspective, it would be having the right team, as well as the team you do develop, keeping them engaged, keeping them involved. It can't be that you open a protocol and then you feel like your work is done. You have to continually re-educate their staff, remind them what's going on, and try to get them to attend meetings, try to get them to attend different training seminars. It's one thing I've told Dr. Black when we go to investigator meetings or we do different type of training initiatives. 9 times out of 10, you walk away really excited and you're really pumped up about that project. And so if you can keep that momentum, then it just kind of keeps everybody more engaged and you'll be more successful in the long run.
And what's the forum that you do that? Is that it's tumor boards? Do you remind people, or how do you get people to know about the trials?
Well, I probably do too much. I do tons of emails, letting them know what we have. I remind them. I will show up in their office. I'm also famous for looking through images and finding patients that they did not tell me about. And they're like, hey, did you not know that we have a study for X? And so they don't like to be caught off guard. They like to be able to refer the patient versus me ask them if we can contact their patient. And for the most part, they're very receptive. The physicians are busy and they like reminders, quite honestly. We also find it's really important to engage the clinic nurses. They are an awesome resource as far as being able to just, remind the physicians. And they know a lot of the details on the patients and they keep up with the patients. And so a lot of times if you build the rapport with the clinic staff, they can be a frontline, help for you as well.
Great. Wonderful. Well, Dustin, I think what we've established is everyone needs an RN, CCRC like Carrie Kay, right?
Yes, absolutely.
That's a big part of establishing the culture. It really is. You can't do it all by yourself, can you?
No,
What's
you can't.
One tip?
My one tip would be that every single patient that I see, especially right after surgery, and I'm looking at the pathology report, it's just in your mind have an algorithm, clinical trial, yes or no, if you can fit them into that. To me, that's where I really capture a lot of patients that would benefit from the clinical trials. It's part of just almost like when I'm reviewing the pathology report. That's the moment. And also engage the patient early on with a concept of that there may be a clinical trial that may help you before surgery even. Just have it in the conversation early on, especially when you're in a patient population where there may be some skepticism about clinical research.
Wonderful. Well, I want to thank everybody on behalf of GOG Partners for joining us for this first installment on how to establish a culture of research. I want to thank Dr. Destin Black and Gary Kay for really giving us some great insights. And I hope you'll join all of us for part two, the second installment of how to do some programmatic building around this and how to build the culture out and actually grow the program. So thank you very much.
Thank you. Thank you.